Right now, school districts across Georgia are buckling under the weight of an escalating student mental health crisis. Classrooms are feeling the strain, and administrators are scrambling for solutions. When parents and district CFOs look at the sheer scale of the problem, they often arrive at the exact same conclusion. Deploying comprehensive clinical therapy across a whole district is financially impossible. That leads to a dangerous assumption. By delaying treatment or relying on sparse temporary fixes, people believe they are protecting both family wallets and district budgets. But avoiding a problem doesn't make the invoice go away. The financial burden of untreated mental health simply moves to a more destructive part of the economic ledger. The first place that ledger bleeds is attendance. When students are struggling, they miss school, creating a massive operational drain that immediately threatens state funding. Next comes the classroom environment itself. Unresolved trauma and anxiety trigger spikes in disciplinary incidents, pushing exhausted educators to their breaking point and driving up the rate of teacher attrition. But the steepest toll comes when the system fractures. Take a look at this comparative bar chart. It shows the compounding cost of emergency crisis response drastically eclipsing the relatively flat, predictable cost of proactive prevention. Without realizing it, schools are already paying for mental health. They are just buying systemic operational failure instead of structured clinical care. The math is clear. Choosing to do nothing is the most expensive option on the table. Fixing it requires a shift in funding strategy. That is where MentalSpace School comes in. They built an operational mechanism that relocates the financial weight of K-12 mental health care away from district budgets and out-of-pocket family expenses, placing it directly onto existing insurance networks. For Georgia families, this visualization shows a meter tracking Medicaid coverage for school mental health services. It fills to 100%, leaving a balance of exactly $0. That means zero out-of-pocket for initial evaluations, therapy, and continuous follow-up care. For the state's most vulnerable students, the primary financial barrier is gone. Cost can no longer be the reason a family waits for help. The model extends to the commercial side as well. MentalSpace operates in-network with major providers like Blue Cross Blue Shield, Cigna, Aetna, and United Healthcare. By staying inside the network, families using commercial plans are only responsible for their standard copay, and frequently they owe nothing at all. To bypass the usual administrative headaches that frustrate families, parents can verify their insurance coverage online in under 60 seconds. Removing that insurance friction takes therapy from a multi-week logistical hurdle and turns it into an immediate, same-day reality for the student. On the district level, this model removes the burden of clinical management from school staff. MentalSpace places licensed, culturally competent therapist teams directly into the school's ecosystem. Because the underlying system is powered by a reimbursable insurance model, schools gain access to professional suicide prevention, staff wellness programs, and same-day teletherapy, services that districts typically struggle to fund independently. District CFOs no longer have to hollow out their general operations budgets or rely on temporary grants to maintain this specialized clinical workforce. When students receive consistent care from these licensed professionals without the friction of cost, the operational data begins to reflect that stability. This multi-metric dashboard tracks actual outcomes. The first data point shows 89% improved attendance. This is mirrored by a 92% reduction in reported student anxiety. Finally, community impact reflects an 85% satisfaction rate among participating families. With financially accessible professional care, the chronic operational bleeding stops, and the district's ledger finally balances. This stabilization comes at a crucial time. Districts are currently staring down a strict deadline, July 2026, for HB 268 compliance in Georgia. MentalSpace provides a HIPAA and FERPA-compliant mechanism that allows schools to meet this legislative requirement well ahead of the deadline. Adopting this reimbursable model takes a looming legal liability and converts it into a distinct operational advantage at a minimal net cost. The conclusion is straightforward. A student should never sit on a wait list because of a price tag, especially when the funding mechanisms to treat them are already in place. Whether you are looking at a family's personal bank account or a superintendent's budget, the math favors acting right now. You can verify your coverage in under a minute at mentalspacesschool.com or reach out directly to begin building your district's mental health infrastructure.